This is the third video he's doing on niacin. It goes into the details of the AIM-HIGH study. AIM-HIGH was the original study in the US, published in the New England Journal about 2012, that docs used to say, look, niacin doesn't work. And what's interesting is, as I covered in a recent related video, this is the author of that study. In this YouTube, he's saying, look, in this video, he's saying, he made the statement, docs are going to see this AIM-HIGH study, our AIM-HIGH study in the New England Journal. They're going to turn around and quit using it, using niacin. But niacin works. That would be a mistake. Sure enough, that's what's happened. Now, this video is not so much about that. I've covered that in another one. It was sort of a short teaser. This video goes into a lot more detail around the AIM-HIGH study. For example, what is it that the study showed that doctors are saying, niacin doesn't work? Well, let's go. Coming right out of the blocks. In summary, this is information out of the study itself from the New England Journal. Again, as I said, I'll put a reference to the New England Journal article for you so you can find it. Hopefully, you can find an available version to look at. But again, I'm going to be covering a lot of details out of it here. December 15th, 2011, New England Journal of Medicine. Niacin in patients with low HDL cholesterol levels receiving intensive statin therapy, or the AIM-HIGH investigators. So, in summary, this is their summary. The AIM-HIGH trial was designed to look at treatment of niacin plus a statin as compared with statin alone. Now, in such patients who had established non-acute cardiovascular disease and guideline-driven, intensively controlled levels of LDL. In other words, these patients were on statins already. They'd been on statins for an average of 4 years. Now, in that group, we found no incremental benefit. So that's problem number one. I know there's a lot of statin haters out there, and if you're a statin hater, don't give up just yet, because this has a significant, very significant impact for you. One of the things this study is saying, and says multiple times, if you're not taking a statin, the AIM-HIGH study has no impact on you. In other words, we know niacin works. We know it decreases HDL. It decreased the HDL in these patients, decreased the LDL and, increased the HDL, decreased the LDL, and decreased triglyceride levels. In fact, that is the next statement. Over the follow-up period of 36 months, there were despite significant increases in HDL, the good cholesterol, decreases in triglycerides, and decreases in LDL, they still didn't see an impact in terms of heart attack, stroke, cardiovascular events. Now, 2 points about that. One is, that gets sort of like the recent studies that I presented. There were a group of studies regarding aspirin, Ascend, Aspire, Esprit, several aspirin studies basically showing much less impact with aspirin. For diabetics, aspirin for older folks. And what you're seeing in the theme there was aspirin doesn't seem to be helping as much because we're already managing blood pressure better. We're managing diabetes better. We're decreasing people's overall risk for heart attack and stroke. That was what happened with this study, the niacin study, way back in 2011, 2012. AIM-HIGH, again, was a study of people that a lot of control had already been established. So, again, if you're a statin hater, you're not going to take statins. Don't think that AIM-HIGH says that niacin doesn't work. It does. Now, let's say you are taking statins and you're saying, well, if I'm taking a statin, should I not Does this mean that I shouldn't take a niacin? Well, that depends, and again, we'll get a little bit more deeper into the details. Before we do, though, let's go back and cover this item, follow-up period of 36 months. Now, if you look at, what's wrong with that? If you look at the research on niacin, and again, there are not 3 or 4 studies, there are dozens and dozens of studies. See my original video on this. They show improvement in cardiovascular rates, outcomes, about 10 years. So what you saw here was an improvement of the indicators, HDL, LDL, triglycerides at 2 years. And then over the next 12 months, they wanted to see a change in heart attack, stroke. That's just too short of a period. So again, these are all reasons why the original author was saying, don't throw the baby out with the bathwater just yet. We expected to see huge improvements from niacin. We didn't see them in these well-controlled populations, and we had to stop the study early. So be careful about over-interpreting it. Now let's go back and talk for just a minute about another thing. This is the American College of Cardiology. They're describing the study, AIM High. AIM High, like all these studies, ASPRE, ASPIRE, AIM High, HPS2, Thrive, all these studies are basically named from acronyms. The acronym here is Atherothrombosis Intervention in Metabolic Syndrome. Low HDL, high triglycerides. So let's go back and understand what that means. What does it mean when you have low HDL and high triglycerides? I've got several videos on that. If you've watched any of them, you're beginning to understand. It means you've got insulin resistance. Insulin, if your blood sugar is high routinely, your insulin is high. Insulin decreases, it stops the burning of fats. So triglycerides go up if your insulin is routinely high. Or in other words, if you have metabolic syndrome. What happens to your HDL if you have metabolic syndrome? Low HDL. So that's the whole idea behind this study. They're taking people with metabolic syndrome. In other words, they've got low HDL, high triglycerides. And here's the other thing. They're saying, we've given them statins. Does this supplement niacin help? Well, what about weight loss? What about cutting the carbs in their diet? What about managing the other pieces of lifestyle, which we know are more important than statins and more important than supplements? Like my friend John Lorscheider likes to say, you cannot supplement your way out of a bad lifestyle. So these people had metabolic syndrome. They had been on statins for a long time, and now they were not doing anything about lifestyle, but they were hoping to overcome the rest of the problem with niacin. It's not going to do it. But does that mean that niacin doesn't work? No. Again, you go back to the original comment by the study author. Okay, so most of this is repetitive. We've already covered it. Among patients with conclusions among patients with already controlled or managed cardiovascular disease, LDL less than 70, they were on statins for a long time. No incremental clinical benefit by adding niacin to statin therapy. Again, I've already covered a lot of that, 36-month period. But here's one thing I wanted to make sure I mentioned. People look at these studies and they always say, oh, there's a lot of big pharma haters out there. And I have my episodes, a lot of hating with big pharma as well. I do not receive money from big pharma. So I'm going to make a point here that the big pharma haters are not going to like, but it's reality. Abbott Labs was one of the funding groups for this study. Don't you think that they would have wanted to show and that they expected to show a positive improvement from their product? I think this was Niacin. Yes, they did. Did they show it? No, they didn't. They put it in, they were part of funding it, putting it in the New England Journal, that they didn't think it worked. So again, a lot of details about this, about these studies. Let's go on and talk about a couple of other things. Now, as I said before, all the patients had already been receiving simvastatin. That was the statin they were using, 40 to 80 milligrams. Primary endpoints: coronary heart disease, death, non-fatal MI, ischemic stroke, hospitalization for acute coronary syndrome. So again, those items on the study design are fairly clear. 3,414 patients. That's a good number. Trial was stopped after a mean follow-up of 3 years due to a lack of efficacy. Now, here's one of the problems. I mentioned before, I don't know what their original study design was, but 3 years, it was clearly going to be longer than 3 years, and I think that was obvious based on how long it takes niacin to have an impact. But again, they started seeing some interesting data coming out. They looked at it. Other people got involved, and they decided, you know what, we need to shut the study down. Despite the fact that at 2 years, niacin therapy had significantly increased HDL from 35 to 42, lowered the triglycerides from 164 to 122, and lowered the LDL from 74 to 62. Again, all very positive impacts. I don't think those are impacts that are going to show in a population of 3,000 people in less than 12 months. And again, at 2 years, you had 12 months or less to show that impact in terms of those outcomes. A couple of other things to clarify. As I said earlier, Abbott was helping fund AIM High. They donated Niaspan, their product, and Merck donated the simvastatin. Companies that provided financial support had no role in oversight or design. And again, I know there's a lot of big pharma haters out there. You're not believing me, but tell me that big pharma wanted to fund something that said their product didn't work. I don't think so. Now let's go back and just do some brief comments regarding some of the other videos that you see out there. I mentioned one which covered it was the American Heart Association coverage of the author of the AIM High study saying, unfortunately, doctors are going to see this and overinterpret, quit using niacin. He was right. That's what happened. And he also said niacin works. We know that. He was also right about that. So we threw the baby out with the bathwater. What's this study? This was my first study. Talking about throwing the baby out with the bathwater. I wanted to get a lot of good, interesting detail on here. And as we're showing this, you're probably saying, what in the heck has that got to do with niacin? That's a standard clinical picture of pellagra. If you get a niacin deficiency, one of the things you get is a dermatitis. That is a very bad case of it. I talk about other ways of throwing the baby out with the bathwater. I started having a senior moment in terms of verbals, and I started listing vitamin B3 as vitamin D3. In other words, I was calling niacin vitamin D3. I started to take that video down, but I've had 30,000 views on it, compared to less than 700, or about 700 or 800 views on that earlier video from the guy that did the study himself. That's why I'm trying to get that study out there, that video. another thing this brings up is where is niacin used in terms of the body? Well, it's used a lot in oxidation reduction activities. It's also used a lot in DNA and RNA repair. And once you start talking about oxidation reduction, health, reversing aging, you start getting into David Sinclair's anti-aging pill. I'm not going to go there today. I am actually, though, going to give you a couple of spoilers regarding the other big study that that deep-sixed niacin with most docs. That study was called the HPS2 Thrive. And here, this was also in the New England Journal. This was in 2014, about 18 months after the other study. Here's basically what you saw from the HPS2 Thrive. HPS2 Thrive showed that adding niacin lirapiprant. Now, lirapiprant was what Merck, I believe, added to niacin to make it a low flush, no flush product. And when they did that, it looks like they did away with the impact. But we'll go on and talk about it a little bit more. You'll hear discussions and pronunciations of lirapiprant or lirapiprant. Most of the time it's lirapiprant. So here is the thing. The HPS2 Thrive study basically showed not any significant cardiovascular improvement. Adding long-acting niacin with people with cardiovascular problems. Again, we had the same problem. They were already taking medications. They were already fairly well controlled, and the impact was just not there. Again, there's also the concern that lirapiprant may do away with the impact of niacin. So here's another thing that happened with the niacin, and I'll cover the HPS2 Thrive studies a little bit later. I don't have time to go into the details on that. Again, just a couple of teasers. Now, there was another big issue that came up as a result of both of these studies. In the AIM-HIGH study, they started to see one of the reasons they closed it down was they saw increased strokes in the group that was taking niacin. That was what drove them to shut the study down early. So there were several other articles that came out later. The safety profile of extended release niacin in the AIM-HIGH trial. Well, after they opened the study books up, what they found was the safety problem with niacin looked the same that it always had. There was a small cluster of people that had strokes early in the niacin trial, but they had it at a time when the niacin would not have created that. So again, more hobgoblins, more witch hunt, more reasons to just, for the doc to just quote, be safe and discourage use of niacin. So here's the summary on the AIM-HIGH niacin safety issue. In summary, in the AIM-HIGH trial, treatment with extended release niacin was associated with significantly increased risk of certain adverse events. Examination of the entire record of all adverse events suggests other possible side effects of this proprietary extended release formulation. The findings concerning serious adverse infectious events have not been previously reported, they won't be. That was just something that happened with that one study, or at least that's what it appears from reviewing the rest of the literature. So I would agree with them. Their overall statement is this: We believe they should be considered to be provisional and exploratory. In other words, what we call in Review of Science a signal. Something happened. Do we know that this is reliable and something we're going to see over and over again? Or was this just something that happened at random? Last comment, and then I'll let you go. It's another comment about the for the big pharma haters. Like in Aim High, HPS2 Thrive had some big pharma involvement. It was funded by Merck. Merck was making the product that had laropiprant with niacin. If Merck wanted something to show to come out of this study, it clearly wasn't that it didn't work. Merck wanted this study to show that it did work, because then suddenly they would have turned a supplement, a successful supplement, into a blockbuster medication. That's not what came out of that study. They basically said the addition of extended release niacin laropiprant to statin-based LDL lipid-lowering therapy did not reduce the risk of major vascular disease. So again, to cap it off, we covered a lot of details. To cap it off, let me just see if I can summarize some items. There were docs agreed and recommended use of niacin up until 8-10 years ago, and then they stopped. One of the major reasons was the publication of a study called Aim High in the New England Journal. Basically, that study did not show a significant difference in people that were already on statins, and in a very short time period, even though the niacin was decreasing their HDL, increasing their HDL and decreasing their LDL and triglycerides. So it had, because of the that study signal of increased negative impacts from the niacin, they had to stop the study. After analyzing it, they thought that the negative impacts, the safety thing, was a red herring. Either way, it did not show a significant improvement. So docs were taking, they were doing like this, trying to figure out, well, does niacin work or not? We've seen for decades that it does, and now all of a sudden, maybe not. Well, then you get another study with another competitor, one from Abbott, one from Merck. It's called HPS2 Thrive, and it didn't work either in terms of helping people who are already on statins in a short time period. So several things to learn from this. Number one, I don't think I would want to take any niacins that have other chemicals in them, like laropiprant. Number two, it's the whole statin hater issue. It's that, you know what? If you're a statin hater and you haven't been on statins, ignore all of this stuff. You need to be taking niacin, especially if you have metabolic syndrome or any problems related to cardiovascular disease. Here's the third issue, talking about metabolic syndrome and problems related to cardiovascular disease. Yes, statins help. They decrease plaque, lipid content, fat content, overall plaque size. But as we all know, the statin haters will tell you, that comes with a cost. If you're going to use statins, use a very low dose, and be careful how you do it. Now, here's one of the bigger items. It's, again, a quote from my friend John. You cannot supplement your way out of a bad lifestyle. So they did not crash these people's carbs. They didn't put these people on low-carb diets. They didn't have these people monitoring their blood sugars to make sure they were 100 or less. They still got some significant improvements in their triglyceride and HDL ratio. But again, do the right thing, manage lifestyle. So it's lifestyle number one. And And yes, triglycerides and HDL are the big issue. Number two, sometimes a statin or a prescription drug will help. Again, if you're a statin hater, there's plenty of good reasons to be a statin hater. If you are, then neither of these studies has anything to do with you. You need to be taking niacin. So again, I hope this was helpful. We bounced around into a lot of the key studies that people have been misinterpreting to mean that niacin doesn't work. Actually, niacin does. Thanks for your interest.